Well, next to the bunion, which I think is the most common thing that I see, we have the condition called hammertoes, and that's where the smaller digits of the foot are curled, and they can often cause calluses on the top of the foot and be very painful. And
so exactly what is a hammertoe?
It's a bending of the toe that's caused by instability of the foot, and it's very common in men and women today, typically aggravated by the tighter shoes that they wear. And fortunately today there are great methods to take care of this condition.
And I often wonder, why aren't they taking care of it? Do you think the perception is it's not covered by insurance?
That is a very big perception because, again, they're really judging the necessity by the way it looks. And a lot of them are actually in denial and don't admit, yeah, that really causes a lot of pain. They just feel they can't do anything about it. So oftentimes you'll find them changing shoes, you'll find them putting pads on it, rubbing the calluses down. I even had a patient that rubbed them until they were almost bruised all the time.
Is that right? So this is a predictable procedure for you. They go in. How long does the surgery actually take?
Typically, per toe, about 15 to 20 minutes to do.
That's it.
And it depends on the techniques and the incisional approaches and things like that.
And again, you're hiding the incisions. I mean, everything is set up. And we've talked a lot off camera based on the cosmetic look of it. So that way their feet will look good in open-toe shoes. Is that correct?
Exactly. The traditional approach to hammertoe surgery has been, again, to make incisions on the top of the toe. And again, if you're in the area of the United States that we're in, which is Costa Mesa, Newport Beach area, where it's all beach and sun, having incisions on the top of the toes is probably the most obvious thing, especially if a person has darker skin and it really discolors. So because, again, of the patients in my area and their demands for having aesthetic-looking toes, I've adjusted my technique to do incisions in discrete areas of the toe.
So again, not every podiatrist is taking care of the hammertoe with this technique, with the technique you're using.
Yes, because again, most people are taught to do the incisions on top of the foot, and that goes for...
It's just easier? Is that what it is?
It is very much easier. It is more technically difficult to do the incisions in between the toes in discrete areas. The other thing, too, that I really am very, very, very concerned about is after these surgeries, typically the toes will shorten. So another change in the technique is I often do use implants in the toe, and that helps to maintain a straighter and a more natural-looking toe.